Hello everyone, now let us discuss about CPT coding guidelines for radiology part 8. In the current session, we will be focusing on clinical brachytherapy. Now, what is brachytherapy? Brachytherapy is a type of internal radiation therapy that is used to destroy cancer cells and to shrink tumors. Clinical brachytherapy requires the use of either natural or man-made radioelements applied into or around a treatment field of interest. Supervision of radioelements and the dose interpretation are performed solely by the therapeutic radiologist. And for insertion of Heyman capsules, you need to use the code 58346, insertion of Heyman capsules for clinical brachytherapy. And for insertion of ovoids and tandems, you need to use 57155, insertion of uterine tandem and or vaginal ovoids for clinical brachytherapy. Now coming to the types of brachytherapy, it is mainly of two types based on the radiation source. It is interstitial brachytherapy and intracavitary brachytherapy. In case of interstitial brachytherapy, the radiation source is placed within the tumor. Whereas in case of intracavitary brachytherapy, the radiation source is placed within a body cavity. Hence the name intracavitary. It is placed within a body cavity or cavity created by surgery. Now coming to the terminology of radiation source. In case of brachytherapy, the radiation source is either called source or ribbon. The source can be intracavitary placement or of permanent interstitial placement, whereas ribbons are mainly used for temporary interstitial placement. Now, coming to the classification of brachytherapy based on number of applications, that is application of radiation source or ribbons. So based on applications, the brachytherapy is categorized into three types: simple application, intermediate application and complex application. In case of simple application, 1 to 4 sources or ribbons are used. In case of intermediate application, 5 to 10 sources or ribbons are used. And in case of complex application, greater than 10 sources or ribbons are used. The codes are categorized based on number of applications. Now coming to high dose rate brachytherapy, it involves treatment with radiation sources that cannot be safely handled manually. And these systems are remotely controlled and place a radionuclide source, which is either a radio element or a radioisotope, within an applicator placed in or near the target. And these applicators are either placed in the body or on the skin surface. One more type of high dose rate brachytherapy is high dose rate electronic brachytherapy. In this case, small electronic X-ray sources are placed in an applicator and are used to generate radiation at higher dose rates. Now, coming to the CPTs of high dose rate electronic brachytherapy. They are 0394T and 0395T. Coming to the description of 0394T, it is high dose rate electronic brachytherapy skin surface application per fraction including basic dosimetry when performed. Now coming to 0395T, it is high dose rate electronic brachytherapy interstitial or intracavitary treatment. The first one is skin surface application and the next code is interstitial or intracavitary treatment per fraction includes basic dosimetry whenever performed. These two are the CPTs for high dose rate electronic brachytherapy, 0394T and 0395T. Now coming to other codes of brachytherapy. The first code is 77750. The description is infusion or instillation of radio element solution. Includes 3 months follow-up care. Infusion or installation of radio element source, which includes 3 months follow-up care within this CPT. The next is 77761. It is intracavitary radiation source application simple. Intracavitary radiation source application simple. The CPT is 77761. Simple means 1 to 4 sources or ribbons. The next code is 77762. This is intracavitary radiation source application intermediate. The space indicates that the description is incomplete and you must look for the complete description. Intermediates means 5 to 10 sources or ribbons are used. The next code is 77763. It is intracavitary radiation source application complex. That is greater than 10 sources or ribbons are used. The next CPT is 77767. Remote after loading high dose rate radionuclide skin surface brachytherapy includes basic dosimetry when performed, lesion diameter up to 2.0 centimeters or 1 channel. The codes are also based on the diameter of the lesion and channels. The next code is 77768. This is also starting with small letter, so you have to look for complete description. The description is remote after loading high dose rate radionuclide skin surface brachytherapy. Here the lesion diameter is over 2.2 centimeters and 2 or more channels or multiple lesions. For all these cases, 77768 must be used. Whenever the lesion diameter is greater than 2 centimeters and whenever 2 or more channels are used, and even for multiple lesions also, you need to assign 77768. The next code is 77770. Remote after loading high dose rate radionuclide interstitial or intracavitary brachytherapy includes basic dosimetry when performed, 1 channel. The next is 77771. Here 2 to 12 channels are used. The next code is 77772. Here over 12 channels are used. These codes come under remote after loading high dose rate radionuclide interstitial or intercavitary. Previous one was skin application. 77770 involves 1 channel, 77771 involves 2 to 12 channels, and 77772 involves over 12 channels. Now coming to next code 77778. It deals with interstitial radiation source application complex. Includes supervision, handling, loading of radiation source whenever performed. The next code is 77789. It deals with surface application of low dose rate radionuclide source. The next code is 77790. It deals with supervision, handling and loading of radiation source. 77790 only deals with supervision, handling and loading of radiation source. One important note is do not report 77790 in conjunction with 77778. Because if you see the description of 77778, there it is included that interstitial radiation source application complex includes supervision, handling, loading of radiation source. For that reason, you need not additionally report 77790 in conjunction with 77778. Finally, the last code is 77799. It is nothing but unlisted procedure clinical brachytherapy. By this we complete the CPTs for clinical brachytherapy. Let us discuss one example. Coming to the example, 32 years old patient with cervical cancer is in outpatient facility to have HDR brachytherapy. Here the cervix is dilated and under ultrasound guidance 6 applicators. 6 applicators are nothing but sources or ribbons are inserted with iridium via vagina to release its radiation dose. The placement is in the cervical cavity. So it is nothing but intracavitary. The brachytherapy type is intracavitary. What CPT is reported for the physician service? The CPT is 77762. The description is intracavitary radiation source application intermediate. Because 6 applicators are used, we are going for intermediate, which includes 5 to 10 sources. Additionally, 26 modifier is appended to include the professional component. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.